You're at the bedside when the alarms start. Your patient is suddenly short of breath. Their oxygen saturation is dropping fast, and the room feels like it's closing in. In this moment, you don't have time to reach for a notepad or consult a textbook. You have to act. The moment a student leaves the quiet of the classroom and enters the high-stakes, often chaotic reality of clinical practice. The statistics for new graduates are sobering. Half of novice nurses are involved in a care error during their first year. Many of these cases involve a failure to rescue, where a patient deteriorates because the clinical signs of danger were recorded but never actually recognized. For decades, nursing education has relied on ADPIE. It's a sequential process designed for the medical record. It ensures that every assessment and intervention is categorized and tracked in a clean, logical order for the chart. But the speed of a crisis rarely follows a straight line. When nurses treat vital signs as mere data entry tasks rather than active alarms, they lose the ability to see the patient's physiological struggle until it's too late. Imagine a 24-year-old patient who just arrived on the floor after a major accident. He's recovering from surgery from multiple fractures, and for the first few hours, he seems stable. You notice his blood pressure is climbing. He's becoming restless and complaining of a sharp headache. You record the numbers, check the box, and move on to your next task, treating these updates as disjointed items on a morning to-do list. As the numbers continue to shift, the internal pressure builds. You have the data, but you're struggling to connect the headache and the blood pressure spike to the trauma he sustained hours ago. Collecting accurate data is only half the job. Without a way to interpret the significance of those numbers in real time, a nurse can miss the onset of a catastrophic decline. To help build the confidence needed for these moments, join the community at supernurse.ai. We've designed these resources specifically to help you bridge the gap between the classroom and the bedside. The Clinical Judgment Measurement Model, or CJMM, is built for the speed of the bedside. It operates in a continuous loop, allowing a nurse to process multiple layers of information and update their priorities as the patient's condition evolves. It begins with recognizing cues. This is where you filter the noise of the unit to spot what matters. You see the blood pressure spike and the restlessness not as tasks, but as specific anomalies that demand an explanation. You move immediately into analyzing those cues and prioritizing a hypothesis. You link the headache to the trauma and realize this could be increased intracranial pressure, a threat that is far more urgent than his healing leg fractures. You generate solutions and take action, elevating the head of the bed and calling the trauma team. Finally, you evaluate. You recheck the vitals and the patient's mental status, looping back to the start to see if your intervention changed the trajectory. This structured approach forces you to move past your first impressions. It provides a reliable pathway to follow when the environment around you becomes chaotic. Back in the trauma room, the nurse acts on the analysis. By elevating the bed to promote drainage and alerting the providers with specific findings, she has shifted the focus from the broken leg to the crisis in the brain. She stays at the bedside, performing a focused neurological exam 15 minutes later. She isn't just finished with a task. She is actively monitoring the effectiveness of her choices. This is where the transition happens. By following a structured cognitive process, a nervous graduate becomes an effective provider who can recognize and stop a patient's deterioration. Mastering this way of thinking turns raw medical data into the life-saving clinical judgment that defines the profession. This shift toward real-time judgment is why the NCLEX is changing in 2026. While the core medical science remains the same, the exam is overhauling how it measures your ability to apply that knowledge in a clinical setting. New unfolding case studies function like a flight simulator. You'll navigate an interface that looks like a real hospital chart, making decisions as a patient's condition changes over the course of a simulated shift. The bow tie questions test your ability to synthesize information. You must identify the primary condition in the center, the necessary actions on the left, and the parameters you'll monitor to evaluate the outcome on the right. These updates ensure that every new nurse has practiced this high-speed decision-making in a safe environment before they are responsible for a patient's life. Remember the difference. ADPIE keeps your documentation organized and legal, but clinical judgment is what keeps your patient safe during a crisis. Internalizing the 6 steps of the CJMM allows you to filter the distractions of a busy unit and focus on the most critical needs of the person in the bed. If you found this breakdown helpful, like this video and subscribe for more. Let us know in the comments which clinical topics you'd like us to demystify next. The next time you feel overwhelmed by your charting, take a breath and look at your patient. Ask yourself, what is the most important cue they are giving me right now? That single question is the start of great clinical judgment.